So if you've got a toothache, this video will walk you through what actually helps and what to avoid. These are safe ways to manage your symptoms for a short time. They're not a cure, they won't fix the cause, but they might help you sleep, reduce pressure, or just help you get through the day. And before we start, a toothache usually means there's a problem inside the tooth, around the gum, or around the bone underneath. And these remedies are not a replacement for treatment. And you still need to see a dentist whether the pain is mild, random, or uncomfortable, or completely unbearable. And that's because small problems can turn into big ones if they're left for too long. And these tips might give you a bit of relief, but they won't make the problem go away. And if the pain lasts for more than 24 to 48 hours, or worse, starts affecting your sleep, eating, and daily routine, then I suggest you get it properly checked. So what actually helps? So these are safe methods and they're backed by evidence. So these are methods I recommend to my patients when they're dealing with tooth pain and I can't see them straight away. And these won't solve the problem, but they can help you buy a bit of time just to manage the discomfort before you get seen. And the first thing is pain relief. So that's either ibuprofen or paracetamol. And painkillers won't fix the tooth, but they can help you just take the edge off. Now, ibuprofen is usually more effective for toothache, and that's not just because it helps with the pain, but it can also reduce the inflammation. And paracetamol, which is also known as acetaminophen or Tylenol in the US, also helps, and that usually helps, especially if you can't take ibuprofen. And some people decide to alternate between both medications. However, I advise you do that only with the guidance of a healthcare professional. Always make sure you follow the dosing on the label, and if you're unsure, speak to a pharmacist. And these are only short-term options. If you're finding yourself that you're needing more painkillers or the pain is lasting more than a couple of days, that's usually a sign that you need to see a dentist straight away to get a proper diagnosis and just to make sure the problem doesn't get worse. And the second thing is saltwater rinse. So a warm saltwater rinse is one of the simplest ways to help calm down the area around a sore tooth. Now here's how you should do it. So mix half a teaspoon of salt into a glass of warm water. Make sure the water is not hot. Then gently rinse the area for 30 seconds and do that a few times. And you can do that up to 2 to 3 times a day, especially after meals. Now this is not going to work for deep infections, but it can help reduce any mild gum inflammation. It can help dislodge any food particles trapped in between teeth, and it can also ease any surface irritation. And just make sure you're not rinsing too aggressively, so it should feel gentle and not forceful. And the third thing is using a cold compress. So if the pain feels like pressure, if you started noticing swelling, a compress can help with the inflammation and can help with the dull sensation. Now here's how you should do it properly. So take an ice pack or a pack of frozen vegetables, wrap it around a clean cloth or towel, and then hold it against the side of your face or outside of your cheek near the painful area and place it for about 15 to 20 minutes and then take it out for another 15 to 20 minutes. So give it a break as well and then repeat if it's needed. And this is important. Don't apply the ice pack directly to your skin or to your mouth. And don't use heat unless specifically advised by a dentist. Now, this is not going to treat the infection, but it can help reduce the swelling. It can help take off the pressure, make the pressure go down, and that can sometimes bring temporary relief. And the fourth thing is flossing the area if the pain feels localized. So what I mean here is if the pain feels sharp, especially when you're biting or you're chewing, and you suspect that it's coming from a specific point, so in between the teeth, then it might be something like food debris that's stuck under the gum. So here's what I suggest you do. So gently floss around the tooth and avoid snapping the floss in or forcing it under the gum, and then rinse your mouth out with a bit of warm salt water. And if the pain is improving after flossing, it's usually a good sign because that means it was pressure related. But if it doesn't improve or gets worse, then the problem is likely deeper and well below the gum. And the fifth thing is stick to soft food and avoid biting on the sore side. So what I mean here is if when you chew, that triggers pain, don't keep testing it. Every bite adds pressure to the already inflamed ligaments around the tooth or the nerve, and that makes things worse. So here's what I suggest you do. Eat soft, room temperature food. Avoid biting anything crunchy or hard or even extreme temperatures, so nothing too hot, nothing too cold. And chew on the opposite side of your mouth. So if the pain is on the right side, chew on the left side. And cut the food into smaller pieces so you don't have to bite down as hard. And resting the area can sometimes give it a chance to settle, even if it's just temporary, and it helps prevent any further damage or irritation. And the sixth thing is elevate your head while you're sleeping. So a lot of people notice that tooth pain or their toothache gets worse at night, especially when it's starting to affect their sleep. And one reason for that is the increased blood flow that goes to your head when you lie flat. And that can cause the pressure buildup, can make it worse around the inflamed tooth or nerve. Now, here's what I suggest you do to help with your sleep. So use an extra pillow to keep your head slightly elevated And try and sleep in a semi-upright position. So don't lie completely flat on your back. And also, if you have a reclining chair, use that for a night or two. But again, this is not going to fix the root cause. That's just going to help reduce a bit of the sensation, especially if it's like a pulsating sensation that keeps you up awake at night. And it can also give you a bit of rest before you get seen. Now, here are some things I noticed people try that might help, but I suggest use with caution. So what I mentioned earlier was everything that's safe, backed by evidence, effective. But there are a few things people try at home that might give a bit of temporary relief. They don't work for everyone, and they should be used carefully. And these aren't treatments, they only help with surface level discomfort. And if you're already in pain or waiting to see a dentist, some of these might take the edge off, at least for a little while. So the first thing is clove oil, which has temporary numbing effects. And clove oil, I've seen, has been recommended a lot of times online, especially for pain relief. And to be fair, there's a reason for that. And the reason is because clove oil has a compound, natural compound called eugenol, and eugenol has mild numbing properties. And in dentistry, we use that in controlled forms also for short-term pain relief. So here's how some people use it. They take a small amount of clove oil, they dab it into a cotton ball or a swab, and they place it gently around the gum or the sore tooth. So here's what I would be careful with. So don't apply it directly to open wounds or broken skin. Don't soak the area. A little can go a long way. And also, when you use it, don't use it repeatedly throughout the day because it can cause irritation if it's used a lot of times. In short, clove oil might dull the pain a bit, but don't expect it to last for too long. It's just a short-term workaround and not a solution. And the second thing is peppermint tea bags, which are soothing, but they're not strong. So this is something I see people do, which helps with discomfort rather than actual pain relief. And here's how it's done. So you soak a peppermint tea bag into a glass of warm water, again, not hot, and wait for it to cool down. And while it's warm and damp, and then place it gently around the irritated area near the inside of your cheek or your gums. And the mild cooling and anti-inflammatory properties of the peppermint tea can sometimes help with the discomfort or the surface irritation, especially if your gums are inflamed or they're sore. And this is not going to help with deep nerve pain or infections, but it's just if the pain is mild, there's a bit of discomfort, if it's gum related, and generally it's a safe, low risk option. Now, these options are safe for short-term use, but they can be limited. You can use them if you want to try something natural, but don't rely on them to solve the problem. And they're just placeholders, and they're not a cure, and they're not the solution. Now, here's what you should avoid. These are things that I've seen that have been mentioned online, or I've heard from patients over the years, people, what they've done to try and relieve the pain. And while some of them might sound helpful or good, they either don't work or they can actually make the problem worse. And if you're in pain, the last thing you want to do is damage the area even more or delay proper treatment. And the first thing here is hydrogen peroxide, unless specifically directed by a dentist. So hydrogen peroxide, I've seen have come up in a lot of DIY remedies, and it can be very easy to misuse. And people I've seen use it too often, at the wrong strength, and without proper dilution. So what it can do is it can actually damage the gums and make your gum tissue worse. It can irritate the soft tissue around your mouth, and it can actually even disrupt the oral microbiome or the amount of good bacteria that you have in your mouth, which can make things worse. And yes, it does have antimicrobial properties, but in most cases, you don't need that, especially if you're dealing with pain or inflammation. So unless you've been specifically directed by a dentist, skip it. And the second thing is aspirin on your tooth or gums. And this one's a classic. I've seen people do this mistake up until this day. So crushing aspirin and placing it directly on your tooth or your gums does not help the pain. And instead, it can cause chemical burns to the soft tissue. It can cause increased irritation, and it does not provide actual relief. So unless you've been directed by a dentist to use aspirin, that means swallowing it as directed. So crushing it and placing it on the tooth or your gums is not really going to do anything. The third thing is garlic, vanilla extract, and other internet hacks. So I've seen these show up in a lot of DIY lists on the internet, but they provide no real clinical evidence. So garlic is sometimes said to have antimicrobial properties. And that's true, but that's only in a lab. If you're crushing it and you're pressing it and putting it against your gums, it provides no real benefit. And the other thing is vanilla extract. And, sometimes it's recommended for pain relief, but again, there's no evidence that it helps, and it's not meant to be used on exposed tissue. And I've also seen other internet hacks like using baking soda, essential oils, lemon juice. And while these might sound tempting because they're natural, they can either be ineffective or worse, even they can be too harsh on the already irritated area. And if you're in pain, stick to what's already proven and safe. So to recap, don't use peroxide unless you've been directed or instructed to by a dentist. and shown how to use it, and avoid using aspirin. Avoid crushing it and placing it on your gums. Instead, swallow it, and that's only if you've been told to. And also avoid using these internet fixes like the garlic and the vanilla extract. And tooth pain isn't always a sign that something is serious, but it should also not be ignored. If it's mild, if it settles quickly, you might be okay to monitor it for a day or two. But if it keeps coming back, worse, it starts affecting your sleep, starts affecting your daily routine, that's when you need to have it properly looked at. And the tips I've shared here may help with temporary short-term pain relief, but they're not going to treat the underlying cause. And when it comes to dental issues, early care almost always means that it's going to be simpler to fix, less invasive, and cheaper. And if something doesn't feel right, please get it checked. We're not here to just fix problems, we're here to prevent things from getting worse.